So hello everyone, warm welcome to today's experience sharing session. It's the first of two sessions that we are holding this week. That is the first every Tuesday 5 p.m. Geneva time, Thursday 12 noon Geneva time, and it's under the auspices of the Movement for Immunization Agenda 2030, and it's part of the full learning cycle that is which started in March 2022 with 2 weeks of the IDS engine, 4 weeks of situation analysis, and 2 weeks of the action planning hackathon. And during those 2 weeks, you were able to develop an IA2030 action plan. And if you have not yet done so, you still have the opportunity. You can still go ahead right now and submit your IA2030 action plan. I'll just complete your action plan. I'll just share the link with you once again right here in the chat. And just to say, you develop the action plan, and the question we ask you is, then what? The Impact Accelerator Launchpad, which started on the 23rd of May, is the opportunity for you to take your plan from paper to activities. And so during this 4-week Launchpad, you, on a weekly basis, your participation is just about you setting a goal that you need to attain by the 17th of June. And while you have set this goal, for you to be able to attain that goal, you need to break it down to actionable activities. And that is why every week we ask you to do 2 things. The first thing you need to do every Monday is to set the action that you're going to complete during the week. And using the link that I'm just sharing in the chat. So the question I'd like to ask you right now is, have you set your action for this week? Have you set your action for this week? If you have done so, can you just type a yes in the chat? Can you just type a yes in the chat if you have already set your action for the week? So I'm going to ask the question again. Have you set your action for the week, for this week? If you have done so, thank you, Stephen. Thank you, Dr. Sawat Kader, for saying yes in the chat. If you have not yet set your action in the chat, please, can you just click on the link that I've just shared? And then you set your action. Once you have done so, you type done. You type done in the chat, because it's very important for you to be able to follow and trace and ensure that you're right on track. And so the next thing you need to do as part of the Impact Accelerator, is that every Friday you tell us how your week went, and there is a link for that. So I'm just going to put in the link as well in the chat. You tell us how your week went. That is every Friday. And it's really about experience sharing, that you set a goal. So you're telling us, have you been able to meet that goal? If you met the goal, you know, what lessons did you learn? What's your success story? If you were not able to meet the goal, what challenges did you face? And you may want to share that so that peers, you can also be able to learn from them. So that said, I'd like to turn, we say these sessions are really about experience sharing. It's about us listening to you, tell us how you are doing. And since it is the Impact Accelerator Launchpad, we'll really be focusing on the actions that you set for the week. But first and foremost, you would like to invite you to remind us of your challenge and your IA2030 action, the goal for your IA2030 action plan. Secondly, you tell us what is the goal you'd like to attain by the 17th of June. And then we have a simple question we're asking you. Did you complete your week 1 action? What happened and how did it turn out? And then is there anything that surprised you? Do you have any lessons learned, any success story or challenge that you faced during the week? And then what is your action for this week, and how will that action help you to achieve your goal? So please feel free to raise your hand if you want to share your experience with us today. So I'm just inviting you right now to raise your hand to tell us how you are doing. And remember, it is not about you. We know that you develop an IA2030 action plan. It's not about you completing, that is completing or meeting all the activities in the action plan within the next 4 weeks. The launch part is really like a stepping stone. The launch part is really like a launch. Is you getting the stage set for you to actually start implementing your action plan. So I see Hassan Benya, your hand is raised. I'm going to invite you right now to unmute yourself.
Hi, everyone.
Hi, Hassan.
Yeah, so for me, let me go straight to the point.
And please start by introducing yourself, please.
Okay, so I'm Hassan Benya. I'm the senior analyst for Clinton Health Access Initiative in Sierra Leone. My major motive is supporting the M&E officers and also the supply chain component department in Sierra Leone. So far, straight to my action points. I think one of my action points was I wanted to increase, I wanted to improve the reporting rates for routine immunizations that has to do with purely the data component. You know, one thing we find out these days, there are a lot of challenges that has to do with the reporting, accountability of the commodities that people utilize across the board. So far, that action point has been developed. And I think my major goal is let me read the goal. The goal is to improve documentation and reporting of supply chain commodities from 50% to 80% in 100 health facilities. But as you know, you said from now to the 17th, we have to make sure that we develop a goal that we can accomplish. So far, the percentage of improvement from 50 to 80% still stand, but this time I'm focusing at 10 facilities. So that is my major goal. In terms of what I've done over this last week, I've been able to make sure that I informed the key stakeholders within the EPI, which is the expanded immunization program. That is by engaging the program manager and then also the deputy. Then again, and as addition to that, you know, I'm working with CHI. It's also good for me to really make sure that I involve my key stakeholders, which is my leadership, my supervisor. So I've been able to inform them. I've actually explained to them the importance of me doing this particular project and then how this project can actually help me to achieve and also support the immunization program within the EPI. So that particular meeting engagement has been conducted. So currently, the current plan is to engage the district level medical officer so that I can actually understand the 10 facilities that I will be focusing on going forward. So the next plan currently is to conduct a need assessment. As of today, I've actually do some literature review to see which areas in terms of need assessment, what are the major indicators I will be focusing on so that I can do that the assessment. So I think these are the two major points I've actually been able to really achieve so far for the past 1 week, which we've started this particular plan. So the next plan next week is to make sure that the tool is being ready, and then before the 17th, assessment is being done so that I can be able to really communicate this particular results to the entire team. That's all I have for you. Over.
Okay, thank you very much, Hassan Benya, for sharing that experience. You have listened to Hassan Benya. If you have any questions for him, please go ahead and raise your hand to ask your question or simply type the question in the chat. And thank you for coming to update us on what you have been doing, Hassan, because I remember last week you shared your experience and you told us what you plan to do, and it's good to see that you were able to realize that. But I just want to ask you, are there any particular lessons that you learned between last week and this week, especially in terms of engaging with the key stakeholders? That is from the Ministry of Health in Sierra Leone, that's the EPI manager and his deputy, and your own leadership at CHI. Are there any lessons that you learned or any particular challenges that you faced when you carry this out? Are there questions that they asked you that enabled you to have a better understanding of what you want to do?
Yeah, so CHI is actually supporting the EPI program on strengthening immunization services across 12 districts. We have 16 districts, but we are supporting 12. And then these 12 districts we are supporting based on tranche. We support the first 4 districts, second 4 districts, and then the third 4 districts. So when I actually explain this information, let me start with the program manager for EPI. When I start this, when I engage him, explain to him about this particular IA2030, for him, I think this information is something that is new to him. So when I told him that this is what I want to do, the first question he asked, is this part of the child program? Then I said, well, definitely it is not. However, it has an impact to what currently I'm doing. That's what he asked. And then I also told him that, then he asked me, what about the funding? Because, doing this particular thing, you have to get a funding to support yourself to do this. Then I said, well, for now, I'm doing it within the Western area. So yes, I can use the little fund I have to visit these facilities. I can use the little fund I have to really support, reach out to the DMO for him to understand that this is just something I want to do to enhance my capacity. So these are the questions they were asking within the EPI program. Then back to my office, which is the child, when I explained this to the program manager and then the entire team, they were saying, well, I think this is just an added responsibility for you. But I said, well, for me, same thing, it's not an added responsibility. It's just that for me to really learn more about how to support the immunization program at large. But one good thing I would say, one of the lessons that I've learned so far is the responsive feedback. The responsive feedback actually helped me to really streamline the type of leadership, the type of stakeholders I need to engage for this program. That one was really done because of the responsive feedback lesson, the modules that I've just completed. That one helps me a lot. And then the other point which responsive feedback was able to help me was to really try to be more focused on the outcome, because the outcome of this is to make sure that the commodities that are being utilized should be documented and recorded based on completeness. So I think these are the two major things that I was able to learn across the board. But other than that, the major challenge is all about funding. Over to you.
Thank you so much, Hassan Benya, for those clear answers to my questions. And I know you are on the right track to actually meeting your set goals by the 17th of June.
Yes, that's what I'm currently pushing for. Yeah.
All right. I see Maryama A. Idris. Maryama, you raised your hand while Hassan was speaking. I don't know if you have any question or concern or comments.
Hello, Auntie Charlotte.
Yes, Maryam, how are you doing?
Fine, thank you. I'm happy to be here today. I don't really have a comment, but what I really want to say is that in my area where I work, I have to table all my challenges and my problems to local government area, because in my country we don't take decisions on our own.
Yes, sorry, Maryam. Sorry, Maryam, can you just start by introducing yourself? I know you, but others in the room, they may not know you, so it's good you introduce yourself so that they'll also know you.
Hello, everyone. My name is Maryama A. Idris from Kano State, Nigeria. I'm a food staff of primary health care, working at Bursala Mohammed Specialist Hospital in Zango Ward, where I work. My hospital is located in Zango Ward. That's where I work. And I am in charge of my unit, immunization department. I work in two departments. I have an annex attached to labor room where we used to carry out our cases of these opportunity vaccines and zero doses cases. That place is attached to labor ward, where we immunize immediately after birth. That is where I work. I'm happy to be here. This is my first time, of appearing on here today. So I'm happy I'm here to learn. I want to learn further. Thank you for giving me this opportunity. I'm grateful.
It's a pleasure for us to have you, Maryam. And can you share your challenge with us and the goal of your IA2030 action plan?
The goals that I have thank you very much. My goal for this IA2030 action plan is IPC on SIA with intervention with other antigens. That's the goal I have. But my challenge is that I cannot carry this action and do it alone. I have to inform the local government area, which they will table this issue to primary agency board. Then from there to Ministry of Health. Then from Ministry of Health, they will have to inform the federal government. Then if it's flagged up, then I will take part in it. I cannot take this action alone, but that is my wish. I want to take part in this SIA, IPC program with some interventions with other antigens. If I'm opportune, that's what I wish. But for now, I'll table my.
So can you define, is it IPC? Can you define IPC and SIA? Is it infection prevention and control and the supplementary immunization activities?
No, ma, it's not. It is not.
So please define.
Okay, I will define that the SIA is a special program on special activity on immunization. Why my IPC is talking about creation and demand, demand generation. You understand? This is what I mean by my IPC.
Okay, okay, thank you so much.
Yes, thank you.
Yeah, and I wanted to find out from you, because you said you cannot take any action without consulting with the local government area. So the question is, have you already started engaging with the local government area?
Yes, I've already tabled my issue forward, and they are looking into it. My own IPC is talking about, identify the stakeholders and communication and demand generation. This is what I mean by IPC, not infection prevention care.
Okay.
So I've already tabled my situation forward, and they are going to hold meeting on it. Maybe they will call me later and tell me what they feel about it. But only me, as I'm in charge of my unit, I cannot carry this. I cannot do it alone. That is it. But I'll tell them the necessary step and what they feel about it, and for them to consider, to take it into consideration, because I feel if it is done, it's going to help a lot of children that already missed the disease prevention vaccine. That is what I feel, and Charlotte, I'm very grateful.
Okay, I know there are lots of colleagues from Nigeria that are here. Probably you have experience around this particular topic, this particular challenge, and you may be able to help Maryam by sharing your own experience. Of course, if you are working around demand communication and demand generation in favor of immunization, and you have had to go through contacting the local government area and the state public health authorities, you may want to raise your hand to share your experience with Maryam, or just simply type in maybe some thoughts in the chat that could help Maryam move forward with the action plan. Okay, so I see the comment from Boma in the chat. Boma, I don't know if you're able to unmute yourself so that you can actually just share with Maryam as well as every other person in the room.
Okay, hello, Charlotte, and good evening, my colleagues. Thank you so much. And I like the boldness and courage of Maryam to come and share her own challenge. And actually, Maryam, it's a good thing you're sharing this. The truth of the matter is, if you are at that level, you have to carry your HOD, that's the head of your department, along the Department of Health. And through him, he can also have access to the SERIC. The SERIC is the State Emergency Routine Immunization Coordination Center. I actually can drop some of these contacts on the chat for you, or maybe we can have access to chat with each other. So through them, they would be able to see that some of these activities you want to do are also brought into their work plan, and then focusing on your own LGA if that is a challenge in that particular LGA. And through that process, you will be able to get the intervention. But one thing you need to understand is the funds may not be there presently, so you need to integrate. If there are other activities, I know SIAs, OPRs, and so on are happening. The supplemental immunization activities, the outbreak responses, they are already happening and they are funded. So through these funded programs, you have the ACSM component that deals with social mobilization and demand generation activities. So through that, you can get in some of these activities, integrating with what is already being funded, and then you can carry out your own activity. And I like your courage, like I said, just try and drop a chat and we'll take it from there. Thank you. Over.
Thank you so much, Boma. That is one of the reasons why we have a movement for immunization agenda 2030. That's the reason why we have the experience sharing sessions, because we don't only come to learn from one another, but we come in solidarity to see how we can support one another move forward with the tasks that we have. And Maryam, if you can just type your contact details in the chat so that Boma could reach out to you, maybe your email address and phone number. That way you can get the support that you need. Emmanuel, I saw your hand was raised. I don't know if.
Good afternoon, Charlotte and colleagues. And I want to actually, just like what Boma has actually added, it is actually a very good courage for Maryam to have added those areas of need. It all goes through demand creation, and then obviously one in the northern part of this country, we have a lot of social mobilization activities which is carried out by UNICEF, and they are solely more responsible to such kind of activities. And when you have issues of demand creation, UNICEF is actually key. So we have one who is one other person who is into this group, and Tina has always been a name, and she's in Kano. So if you can get through Boma, or Boma can equally connect you to Derek or Lyric. There's Lyric. You work at the tertiary institution. So, but then there's this organogram probably at the LGA level, the local government level, where you have a different ball game entirely from the state level. So, and then with the institution, this is tertiary, then you are now going to a primary health level. So the HOD, which is, some of them are HS, we call them health secretary, some are director, PHC, or whatever name the nomenclature is being used. So you reach them, and then you can get a way out. Now, equally, there are partners where, when before activities, there's what we call, you analyze situation based on high risk analysis, and then there's high operational plan. So those operational plan, we now capture them based on those plans, those on areas based on the risk categorization you are, so that there should be special funding or plans for it. And then in other states, again, they do a lot of in-between round activities. So even if those things are not captured in between the campaigns, there are activities that are done in between rounds, between this round and the next round. So they can equally be captured, and then they can be able to support you. But don't actually don't die in silence. That's the common word for the Geneva learning. So you should just air your problems out, and then you see that you have a lot of support. You are doing well, and I'm sure you equally do well. One other aspect, we have the Nigerian learning group that you can equally join and then see us through, and then we can be able to support you. Thank you, Charlotte, for giving us the opportunity. Thank you.
Okay, thank you once again. Thank you once again, Emmanuel Musa, for sharing that. I am sure Maryam, she has taken note, and we do hope, Maryam, in the coming weeks, you come and tell us how, if you have gotten a breakthrough and how far you've gone. So we are like 6 minutes to the 30-minute mark for today's experience sharing session. And please go ahead and raise your hand if you want to answer the questions that are actually on your screen right now, in terms of what you planned for last week, how it turned out, and what you have planned ahead for this week, and how that will impact your goal throughout the Impact Accelerator Launchpad. Earlier on, I saw Edwin Simple, your hand was raised for quite a while. I hope you're still able to speak with us. And I'm just putting the questions again in the chat. Maybe you're using your phone and you can't see clearly. So Edwin Simple, I'm asking you to unmute yourself. I hope you're able to do so to share your experience with us today. And I do hope connectivity is on your side. Okay. And Maryam, I see Boma has shared her contact details in the chat. So please reach out to her if you're able to do so as soon as possible. I'm sure you'll be able to get the support that you need to move forward with your IA2030 action plan. So many of you were able to, when we looked at the list from yesterday, you actually spelled out, you share your experience for the week. So I'm sure you should be able to raise your hand. I see Eziani Anthony, the education sector and universal health coverage youth ambassador for Malaria Youth Army Champion, submitted. So Eziani Anthony, thank you for taking out the time to really write everything in the chat. I don't know, I hope you're able to unmute yourself. That way you can actually explain what you have been able to do so that everyone in the room will hear you. Eziani? Okay, if not, I'm just going to read what you wrote. Surely you're in a position where you're not able to speak. So you said, I am in the education sector and universal health coverage youth ambassador for Malaria Youth Army Champion. I have submitted my action plan. My goal is to save lives, prevent premature death and disabilities, improve ability of children to learn, reduce health sector costs for hospital care and economic costs to society from absenteeism. My action was that before 2030 as a framework to prevent millions of deaths through vaccine coverage, to zero dose children and more equitable access to existing vaccines for children in all communities. This will involve all ministry, government official, health professional, academia, global agencies, development partners, immunization colleagues, etc. What surprised me a lot was the knowledge gained from responsive feedback to address the inherent complexity and unpredictability of implementation challenges. It also helps in addressing field reality. So thank you for sharing that, Anthony. But what I would like to say is you have a very broad goal. You have a very broad goal, and even your actions themselves are so broad, and so much so that at some point we don't know how are you going to measure success if you're able to implement that. So if you could go in terms of specifics, in terms of priority, among these actions, among these goals, what is the priority? What can you focus on? And what results will you seek to obtain? And you have listened, those in the room, you have listened to what Anthony has shared. So I'm encouraging you to raise your hand if you want to speak or to ask questions to Anthony, or to share with Anthony based on your experience, you know, how specific he can get as far as his action plan is concerned, because it looks very broad. And so can it be in terms of contextual? Where is your scope? Where is the scope of implementation? Is it the whole of Nigeria? If it's the whole of Nigeria, what resources do you have to be able to attain that goal? Is it at a state level? So it's good to be kind of specific. And then specifically for this week, you know, what did you plan last week? What were you able to achieve? You know, what did you plan for last week? What were you able to achieve? What are there any success stories, lessons learned? And for this week, what have you planned? So that by the end of the week, you'll be able to measure, you know, based on what you have shared in the chat, you will not be able to measure the progress you have made. And that is really important if you're going to attain your objectives at the end. So the room is very quiet today. So please feel free to raise your hand, you know, and share with us. I'm just going to go visit the list that was shared yesterday of those who submitted, who shared their experience at the end of last week. So, and I'll just turn towards you to unmute yourself and tell us, you know, what you did and what you're planning to do this week. So invite you to respond the questions in the chat. So I'm just revisiting the list. Okay, so Farm, I'll be inviting you to unmute yourself. I hope you're able to speak with us, Farm Daniel. I'm asking you to unmute. Okay, Farm Daniel, I saw your name on the list of those who actually shared their experience at the end of last week. It means you defined an action at the beginning of the week that you were able to complete partially or completely. You're going to tell us. So please, can you just go ahead and answer the questions? Farm Daniel, I see your mic is unmuted, but we are not able to hear you. But I can actually hear some background noise. Unfortunately, we are not able to hear from Daniel. We'll surely come back towards you in a short while. So I see Nelson Mandela, your hand is raised. Are you able to unmute yourself? Okay, so please, are you able to hear me? Can you reassure me on the chat? I hope it's not my connectivity that is failing. Can you reassure me in the chat that you're able to hear me? Can anyone reassure me in the chat that you're able to hear me? Hi, everyone. Can you reassure me in the chat that you're able to hear me? Okay, thank you for reassuring me, Boma. I almost felt as though I was talking to myself. Okay, that's great. All right, so it means the issue is probably with the others that are having problems with their connectivity. So normally our session is usually 30 minutes. So if there are no other experiences to be shared for today, we can separate. But before that, I just want to remind us, if you have not yet set your action for the week, remember there are two things you need to do every week as a participant in the Impact Accelerator. The first thing is that you set your action for the week. And if you have not yet done so, I'm just going to share the link once again with you in the chat so that you will set your action that you complete by Friday. And once you have done so, just type done in the chat. I saw a lot of people, or so you set your action for the week that you need to complete by Friday. So please just go ahead and do so. If you have not yet done so, I'm inviting you to do so right now. Just click on the link that I've just shared in the chat and set your action for the week. And then on Friday, you need to tell us how you are doing. Friday, we just want you to, you have to tell us if you're doing fine, it's good, it's okay. If you have a problem and need help, we are always there to help you. Do not suffer in silence. That is our motto. And then if you want to share your experience, I really encourage you to do so. So if you have been able to carry out the action that you planned during the week, you have the opportunity to share your experience, to tell us what did you learn. If you have any challenge that you face, to share the challenge or any success story, and then we'll be looking forward to meeting you during the next experience sharing session or during the Global Assembly on Monday to recognize you specially. And I'm just sharing the link in the chat as well, even though you're going to receive that also by email. And I see Nelson Mandela that says he's having issues of connectivity. You don't have to apologize, Nelson Mandela. We do understand. It is something we all go through. Also, if you want more ideas on how to implement your IA2030 action plan, you can still visit the IDS engine. It's accessible to all members of the movement for Immunization Agenda 2030. So you can always access the IDS engine to see ideas that could help you, especially if you're facing challenges. And then if you have issues of poor connectivity, we have our podcast. You can go ahead and subscribe to the podcast where you can listen to the sessions that you missed, audio versions of the sessions using low bandwidth option. That is using our podcast. And last but not the least, we have our next experience sharing session. Our next experience sharing session that is on Thursday at 12 p.m. Geneva time. That is at noon Geneva time. So register, go ahead and register for the next experience sharing session to come and tell us how you are doing in terms of the action that you plan for the week and in terms of implementation of your action plan. Remember, we don't expect you to have implemented your IA2030 action plan by the 17th of June. No, the Impact Accelerator Launchpad is really about you getting set. It's about you taking steps. For some people that say they may need additional resources to implement the action plan, it could be an opportunity for you to start engaging with the key stakeholders, like Maryam is actually doing, right into maybe getting in touch with the head of department for health in her unit, who help her to have access to the local government area health authority or to the state health authority. Those are steps that she's taking towards implementing her action plan. So it's really about you not sitting and waiting, but taking steps to move forward. It's really about you setting the stage for implementation. And so that is why we ask you to carry out a weekly action, so that every step of the way you break down that main goal into actionable steps that you can actually take 5 working days to implement. And that way, at the end of the 4 weeks, you would have taken a major step. But it is still admirable for those who have already actually started implementing, but not implementing large scale, but doing some piloting, like we saw with Hassan Benya, who shared today that instead of focusing on 100% of the health district that he wanted, of the facilities that he wanted to reach out, he decided to start with 10 facilities, knowing that within the 4-week period, he will be able to reach these 10 facilities. And I am sure that after the 17th of June, he will do maybe an auto evaluation to see some of the lessons learned from the 4 week from the work done in 10 health facilities, and see how potentially he will be able to scale to do at scale for the other health facilities in his country, Sierra Leone. So that said, I'd like to thank you all once again for your participation in today's experience sharing session. Look forward to seeing you on Thursday at 12 o'clock Geneva time for another experience sharing session. Until then, continue to have a great week and continue to work on the implementation of your IA2030 action plan. And please don't forget to set your action for the week if you have not yet done so. And I'm putting the link again in the chat. I see James Viti, you are raising your hand at the end. So I'm still going to ask you, are you able to unmute yourself? James, if you're able, if your hand was not raised accidentally, just go ahead and unmute yourself. Sorry, James, James, are you able to unmute?
Hello.
Yeah, hi.
Yeah, my name is James Tuckolon from Liberia. Last week, I set up my goal by reaching, because we are administering the COVID-19 vaccine to the various schools, high schools in our district, and I'm one of the supervisors. So, and we started the process. What I did at the supervisors, I was able to engage the stakeholders, and those stakeholders are the teachers, the school principals, to meet with them by telling them about the importance of the vaccine, so that when the vaccinators go there, they'll be able to accept them. So I have them informed, and I met with those various schools. I met with them, and we were able to talk with them they accepted that, okay, we'll be waiting for this week. So we planned for this week now to meet with them, and we started yesterday, and the vaccination is ongoing. So that's the next plan, that's how we have started with them.
Okay, thank you, James. I have a question. Yes, thank you, James. I have a question for you. Is this action that you carry out last week and you're planning to carry out this week, is it in line with your IA2030 action plan? Can you just remind us your challenge and your goal for the IA2030 action plan?
Yes, it's in line with them. It's in line with that, the action plan. So this action plan now by the plan. So we are trying to implement the plan now using this identity, this goal that we are talking about, the accelerator impact.
Okay, so if I got you well, you are trying to increase uptake of COVID-19 vaccination among school children in your, in your district or in your area of intervention. Is that right? Unfortunately, James is having issues of connectivity, so we are not able. I'm not able to hear you, James.
Yes, of course. Yes, we are trying to, because we noticed that there's a low uptake, so we are trying to see how we can engage those stakeholders, so that, because the principals, the school principals, the teachers, they are the one that will be able to convince, the children, also to make sure that we can be able to get them vaccinated. So that's my plan we made, and that's a plan I submitted as my action plan, and now we are using that now to be able to initiate the vaccine update.
Okay, thank you so much. Thank you so much for sharing that, James. And so last week you said you wanted to identify the key stakeholders and got in touch with them. So this week you say you're organizing a meeting.
Yeah. Yes. The meeting, I think yesterday, we have a meeting with some of the school teachers and the principals, and also on Sunday I have a meeting with the parents, by telling them about, because the refusal of the vaccine is high on our agenda here. So able to talk to the parents and in some schools. So on Sunday I visited 2 schools. I attended their meeting, their PTA meeting, Parent Teacher Association meeting. So I was able to talk to them for the importance of the vaccine. So they accepted that, okay, which will be allowed to start with the vaccination. So yesterday, which was on Monday, we started with the vaccine, and now they are responding. Yes, and it's in line with the plan that I submitted. The plan I submitted.
That's wonderful, James. And I just want to find out from you, how many schools in total do you have to visit?
Basically, we had about 30 schools in the district. So I plan to meet with 5 schools per day. So that why I did that 5 schools per day. So last week I started with it, and I was able to meet up with all of the schools, and then I have that awareness. And in so doing, I also having a radio program where I get awareness on the radio talk show, because I already developed a radio talk show here where we also do. So I also use that medium of giving information to all of the high schools in my district. So that's how I did the plan.
Okay, thank you, James. And probably my last question, hopefully, is so in terms of resources, where are you getting the resources to carry this out?
Okay, thank you so much. And I have here the partners here, WHO, also here with some partners like Concern Worldwide is here, Landmark Health is here. So we engage them also to be able to help us when it comes to transport to go to the area. So that's why we are getting the resources from. And the issue now we have now is that we have a challenge of the vaccine. Most of the Pfizer vaccine, that we have out of 8 in the district, and we not having J&J vaccine that we are using for 18 years and above. And the challenge we have now is that those that took the first dose of the Pfizer vaccine, And now it's all. So they were now in the school now, the teachers were asking us that, oh yes, but you are saying that the vaccine were available, but now we notice that you people coming out to tell that the Pfizer vaccine is available. How would it second dose? Because the Pfizer vaccine, the challenge we have now currently now we are facing here now, as we are giving the vaccine, the other vaccine, the J&J vaccine now to the 18 years and above, that is a one dose. That's the only challenge that we are facing now. So, and other schools were asking that, oh yeah, but now we came here yesterday and our children took they came to do their second dose now, and it's not available. How will the children receive their second dose? Only the J&J you could bring in here. That's a serious challenge now we have now in the district. Are you getting me?
Yes, I'm actually getting you now, James. I actually had an issue of connectivity on one of my devices. So you were talking about vaccine stockout, is that right?
Yeah, yes. What I was saying that we have there are two different vaccines that we are using here now. The first vaccine that are given to 12 years old and above, which have the two dosage, and a J&J vaccine we also using, which is given once for 18 years and above. So we started with the exercise, and the reason why I came up with the plan that we're having low uptake, because the response rate was too low by the schools in the district. So that's why now the actual plan came in and said, but it will help me in the process. Then how I came on and make the plan that by engaging the stakeholders, and my stakeholders are the teachers, the principals, the support staff. So I had a meeting. I started to have a meeting with them, and now they accepted that. Okay, they are seeing that they are seeing me convincing them now to make sure that the children can take the vaccine. But yet the challenge we have now, we get the. Yeah. Mm-hmm.
I just wanted to find out from you, do you have the possibility of engaging with your hierarchy, the EPI program to supply for you to get additional vaccines?
Yes, for I speak to you now is that we already engaged the WHO is aware of it, and the national program is also aware of that now. They are trying to see how best they can procure a vaccine for the second dose so that we can be able to administer. So what we have now, currently now, because the program has started, the 5 weeks program activity we have started, so we are using it that while we are starting with the J&J, we also send communication that we need the first vaccine for the to the first dose. So that information have been sent to them that they are trying to respond to us that maybe next week they are seeing how best they can procure the vaccine is available in country, but it's not in our district yet now. So we have given that information to them that okay, this is how we are.
Okay, and can you just tell us, do you have an idea of the coverage, the vaccination coverage in your district for COVID-19?
Yeah, for currently now we have a 52%, coverage. We have now, I speak to you, 52% coverage. So we have to see how best now people engage other areas so that we can reach the full coverage. So we stay at the level of 52%.
Thank you so much for sharing this experience, James, with us. And we wish you all the best. And we are sure you, in the coming weeks, we'll come back to you to see how far you have gone. And we do hope that you're able to get the Pfizer vaccines for the second dose, because we'll be coming back to find out also about the coverage for second dose. Okay, so far we are okay. I'll listen to it, and we will continue to engage our hierarchy to make sure that our coverage, because as we are seeing that the raw uptake is still here, and the perception of people say had it, but as we are engaging them, the stakeholder are the one to ownership of the program. So as they are accepting now, we are seeing that our coverage will be increasing. Okay, thank you so much. Thank you once again. And I was already concluding the meeting, and now I have 5 hands raised. So I'm going to start with Edwin Simple. Edwin Simple, are you able to unmute yourself? I hope connectivity is on your side, or we'll take Kingsley. Okay, over to you, Edwin.
Okay, so I thank you, James, for your presentation. There's something you said I just got to my interest. You said you were using, did you say you were using Pfizer or any of the vaccines for 12 years and above? And one other question I wanted to confirm from you is these schools at which level of schools institute are these? Are they primary schools, secondary schools, or nursery? Are they primary, secondary, nursery, or tertiary institutes that you are engaging for this COVID-19 vaccine? I think I would have appreciated if you're specific on the institute. And please, I also want that clarification on the vaccines you're using for 12 years and above. I don't know if I heard that clear. Charlotte, I think that's the question I wanted to ask. I don't know if I should go ahead saying the goals for last week, if I actually met the goals for last week.
Edwin will surely take your goals during the next meeting because we are out of time during our next expansion session, but I think I can turn towards James to answer your questions. Okay, so James, did you hear Edwin's questions? He wanted precision. I know I heard that the J&J was for 18 and above. The Pfizer vaccine was for the younger children, but can you specify which vaccine was meant for which age group, and that the schools that you go to mobilize stakeholders, which are they?
Okay, thank you so much for that questions. The schools we are engaging both the primary and secondary school. Yes, so when it relates to the vaccine, the Pfizer vaccine, it is administered to children from 12 years and above, which is how we're having the 2 dosage. And for the J&J vaccine, Johnson & Johnson vaccine is administered to children 18 and above. So we are because at first the J&J was first administered, but later now we noticed that we have a vaccine for children 12 years and above. So that's why we are using. But now, as I said, the challenge we have now is that for the children that will receive the first dose of the Pfizer vaccine, now they should be taking the second dose. But now we're out of the Pfizer vaccine. That's the challenge that we're having now. That's the reason why we have already communicated to the national level that, oh yes, those children that took the Pfizer vaccine and they need to take their second dose vaccine. So there we are now on a challenge. But for the Johnson & Johnson, which is given 18 years and above, we have already started. We also continue to give them, to various schools. Because specifically, although they have community, but for me, I'm assigned with the schools in my district. Yes, my answer is clear.
Thank you very much, James. I'm sure you've answered Edwin's question. Edwin, you can indicate in the chat if you've got an answer to your question. Edwin,
I think I got the answer to the question, but sorry, I just wanted to know from which country are you reporting from? So
Liberia. Liberia.
Okay.
Yeah.
Okay. Thank you.
Okay. Thank you too. All right. I think we are going to end it here for today. And
yeah, 19 years, 18 years old.
Okay, we are going to end it here for today. And just as a reminder, once again, if you have not yet set your action for the week, I shared the link in the chat. I'm just going to share it again so that you can do so. So set your action for the week, and on Friday, we'll come back to you to find out how you are doing.
Okay.
I've just shared the link in the chat. Yeah, Kingsley, I'm listening to you.
Yes, thank you very much for the opportunity. Yeah, I'm actually called Kingsley Kofi, speaking from Ghana, working with Community Youth Development Foundation. Yeah, per his presentation, if I understood him very well, he said he targeted 5 schools per day. And I want to find out what is the distance between those schools within the district that he's implementing. And is he doing that alone, or he's doing that in collaboration with a team? That is my question. Thank you.
Okay, thank you so much for your question. And James, I'm turning back towards you. You see, your experience sharing has, unfortunately, James is no more in the room. So, but I do hope that you take note of this question so that in our next session, if he's there, we can come back to him, because that's really relevant. But one thing I heard from his presentation is that he is not working alone.
Okay.
Yeah. All right.
Okay.
So, but I do hope we are able to get him again and during our next experience sharing session, that is on Thursday at 12 p.m. Geneva time, and you can go ahead and register for that session. Do hope you'll be able to join us and we'll be able to hear more experience sharing during that session. So I just want to wish you all once again an excellent evening, excellent day, depending on where you're joining from. And wish you all the best for the rest of the week, and look forward to hearing how you're doing on Thursday during our experience sharing session. Until then, bye for now. And
Thank you very much.
Thanks everyone.
Thank you very much. Regards to Rida and Co.
Yeah, they'll get your greetings.